You guys can hear me and can see the slides, kan?
Yes, doctor.
So just now was public health ethics. It is very relevant to current situation. Yeah, individual rights can be overruled in the event of public health issues. Yeah, all right. So now is global health ethics. Yeah, which is maybe you guys first time hearing this, but actually you guys has the concepts of global health ethics has already been instilled in your system. Yeah, tanpa disedari you dah ada exposure sikit-sikit to global health ethics. Right, we will see. Okay, so ni yang tadi tu. So basically this is what we will learn today dah. Basically kita nak revise balik what is public health, what is international health, and what is global health. Sounds the same, but there are the history behind it, and we will see. And what is global health ethics? What is the issues with the global health, and why do we need it? And this is the issues that we can observe: ethical pluralism, human rights, equality, equity, and sustainability. All right. All right. Okay. So you guys already know what is public health. You have done PHPM when you are year 3. Yeah. So the sejarah of public health is developed in the 19th century in UK, Europe, and US. Yeah. So public health is concerned with the national issues. Yeah. The first observation of public health punya principles is can be seen in the cholera outbreak lah. Okay. So it is at the time, yeah, there is data and evidence that is being used so that the certain diseases can be prevented. So in terms of cholera, okay, in the past, people has discovered siapa-siapa yang tinggal dengan kawasan yang ada pipe air, they will be affected the most. So sebab dia akan minum air dari situ. Orang yang jauh-jauh yang minum air telaga, they are selalunya terselamat. Those who are living near within the pipelines, they are affected with cholera. Okay, so this is how public health first discovered. Yeah. So this is John Snow, the father of public health. Pada beribu-ribu tahun dululah. Okay, 200 years ago. Okay, he discovered those who are living nearby the pump are affected by cholera, yeah, because at the time sewage, yeah, you punya buangan toilet tu is not separated. That's why people are having cholera. Just by having a separate sewage system and the water system, you can easily prevent cholera easily lah. Okay, so this is public health. They use science and data, yeah, population around the surroundings semua tu. So that is public health in history. Okay, then we have international health. Okay, international health ni public health dia tend to be focusing on the locality, dalam negara, dalam community, aku. Yeah. International health is extension of public health. You pergi negara lain, okay, untuk bantu. For example, rate dekat mana-mana, ya. Taufan. Okay, public health fokus kepada dalam negara, dalam community. International health fokus kepada luar negara, tetapi the focus is on diseases. Yeah, focus on condition, for example, perang, natural disaster, and countries yang tak ada duit sangatlah, miskin sikit. Okay, and this is the first concept that transcends the national boundaries. So international health has been implemented for a very long time. Okay, bila tsunami, people will come and help. Yeah, people akan bagi food aid to the countries yang miskin. Okay, even Malaysia pun ada bagi bantuan. So this one is for Myanmar. For Myanmar ke? Yang apa? Sorry, Rohingya. And also Myanmar lah yang ada etnik yang kena bunuh dekat Myanmar ramai-ramai tu. Okay. Alright, so apa bezanya international health and global health? Okay. So international health is tend to give health aid, kita bagi bantuan perubatan, bagi bantuan makanan. But global health is beyond that. Okay, so dia greater interdisciplinary approach. Okay, Alright. This is the official definition of global health yang I pun tak larang nak baca. Okay, but the highlight point is the most important one. Health tends to focus on individual country bantu, but global health is global efforts to menyelesaikan masalah, and the effort should not be focusing on health alone. Dia perlu ada societal solution, cultural solution, and economic solution. Yeah, so we will observe this. Yeah, alright. Health is very related to economic. Yeah, so health is very related to education. There is data that show people that have higher education, they tend to live longer, and this is a solid evidence. Okay, in the past kita cuma bagi bantuan in terms of healthcare and everything, but global health is like giving education. Okay, bagi business to poor people. For example, you pergi buka kilang dekat negara miskin, and that is one of the some examples of global health strategies. You nak improvekan health certain countries yang miskin, instead of buka hospital, you buka sekolah, and that is a strategy of global health. Okay, so this is example. Yeah, so we know cholera, and it is caused by Vibrio cholera. Yeah, this is the scientific basis. But scientists feel that the bacteria itself is not the root cause of cholera outbreak. Okay, what we used to think that cholera enters the contaminated water and people will get cholera and it become an outbreak. Okay, but in the reality is it is a disease that is associated with poverty. Okay,
It's 3 o'clock.
Hanya orang miskin je yang dapat poverty. Orang yang kaya selalunya tak akan dapat cholera. Okay, so the real root cause of cholera is poverty, because these poor people has no access to clean water. Okay, rich people never got cholera. Cholera is not a medical disease. Yeah, it's not only a medical disease, but also a social and economic disease. Okay, the prevention must also be focused at the social and economic part. Okay, so the aim of global health is how do we help someone to escape from poverty, and do we have a duty to help? Okay, as a doctor. Okay, I know the focus in medical school is you nak diagnose and treat patients. Yeah, tapi bila you dah jadi doktor nanti, jadi pakar nanti, you buat somebody yang buat healthcare policy. Yeah, you jadi menteri. This is an issue that you have to handle. Okay, you bukan kena jaga negara you saja, but you have to be involved in the well-being of the world. Okay. Okay, so global health, their focus is on the vulnerable groups, yeah, the poor, the children, women, elderly, and discriminated groups of any kind. Okay, gambar ni gambar orang Rohingya, orang Myanmar. Okay, and poverty is associated with discrimination. Discrimination is based on ethnic origin, language, and religion. Okay, masa COVID started, many people discriminated Chinese from mainland China. Okay, so dekat Malaysia, we discriminate people who speak other languages and religion, which is quite common. Yeah, and we'll see how this manifests. Okay, so poverty is associated with discrimination, and these people are excluded from jobs, tak boleh kerja, tak dapat education, and denial of healthcare. Okay, which is kalau you deny all these three, it will have impact to their health, which eventually akan menjahanamkan our healthcare system also. Okay, for example, if you are aware, restoran tak boleh ada warga asing in certain states. For example, Penang, jual makanan tak boleh warga asing. In KL, pasar tak boleh warga asing. So warga asing, they have limited place to work. Okay, even in terms of education, and you guys are aware that education is the fundamental human right. For me, it is an important one. Okay, tetapi Rohingya, kanak-kanak Rohingya in Malaysia, they are not being educated. Okay, so this is a serious thing that has to be overlooked lah. So their healthcare is at serious risk. Okay, something that we have to ponder about, the top 26 billionaire now own as much as the poorest 3.8 billion people. Yeah, so this is an issue of inequality around the world, yeah, which is out of control. Yang kaya kaya sangat, yang miskin miskin sangat. And these 26 people, kalau dia dermakan half of the duit, this can really save the 3.8 billion people. Right? So that is the essence of global health, and this is some of the contemporary issues that you have to be aware. Yeah, isu-isu semasa berkenaan dengan global health. Okay, obviously pandemic, we are already aware it has come to our doorstep. Mass migration is a problem. Climate change is affecting the whole world. Antimicrobial resistance is affecting the whole world. Okay, so Malaysia sekarang kalau batuk demam tak akan dapat antibiotik free ya. Tapi if Malaysia alone working on this, negara lain tak ikut, ya, the resistance will still be developing lah. So it requires a global effort, and this is the issues in global health. Ya, kita ada Ebola and high threat pathogens. Ya, another issues that has been discussed before COVID happened. Ya, is vaccine hesitancy. Banyak anti-vaksin zaman sekarang, so many emerging diseases yang dah pupus, ya. HIV is also a global health issues. Alright, so mass migration and ill treatment of refugees, ya. So banyak student confused, how is this related to healthcare? Yeah, how is this related to me, medical student yang study medic? Why is this relevant to me? Yeah, because this is not the jurisdiction falls under health minister, it falls under minister dalam negara, ya. So but it has serious health implication, banyak disease outbreak dalam tempat kurungan ni, and it's a serious and these people dia tak dapat access to healthcare, and as you are aware, there are many outbreaks, ya, dalam detention center for immigration, ya, and this is because the poor condition, ya. And we have, as a doctor, we have to be aware of this, and we have to see this as a global health issues. Yeah, global does not mean that it does not happen in our country. Yeah, it can happen within our country, and as a doctor, kita kena protect human rights lah. Okay, alright. So a bit difficult to change, yeah, because this is not been covered in any newspaper. But the condition, the living conditions, yeah, they are being detained very poorly in the detention center. So yang ni memang social distancing is impossible. Okay, right. So for women it's like this, very closely dikurung, and children is also dikurung lah. Okay, it happened in Malaysia, bukan nak mengutuk kerajaan ke apa, but it's happening elsewhere also. Okay, and this is a global issue that needs ethical and moral reflection. Okay, right. Alright, so for example, Rohingya. Okay, this is an immigration issues but requires a global health intervention. Ya, semua orang tak nak bantu, semua tolak pergi tengah laut. Okay, so this is what happened to Rohingya, and these people are dying, even children. Okay, kalau kita tengok mortality rate dekat Malaysia tu, orang tak kira pun mortality rate Rohingya mati drowning. Okay, people tend to ignore them. Okay, so this is America, right? Border with Mexico. So Mexico dia banyak jenayah, so people are fleeing from their own country to America, but they are detained. Okay, on top of that, berlaku COVID and many people have contracted the virus. Okay, climate change. Okay, apa kena mengena dengan doktor. Okay, we have also to be aware of this issue. Yeah, bila banjir berlaku, alright, ada serious infection will happen, ada healthcare issues that will happen, ya. Even our hospital pun pernah tenggelam. Okay, so global health is trying to address this issue, ya. Bukannya sekadar buat parit, okay, but we have to find the root cause dan sama-sama menyelesaikan masalah. Okay, for example, we have masalah jerebu, and that is not from our country, tapi we should have a global effort to solve the issues. Yeah? Sebab if we rely on Indonesia alone to help to solve the problem, It will take a very long time. Okay, kita perlu sama-sama bantu. Okay, so Ebola, right? So sekarang dah ada COVID, everybody is forgetting about Ebola. Okay, Ebola is sebab orang makan bush meats, yeah. So this kelawar dia ada virus Ebola, and it predominantly happen in Africa, and because it's happen in the poorest country, tak ada orang nak tolong mereka. Okay, so Ebola outbreak is ravaging the country. People is dying from hemorrhagic death, yeah. And only after the virus landed on America, barulah orang nak tolong. Okay, so you have to see this. Okay, you have to be aware. Bila ada disease baru dekat infectious disease in particular, bila ada infectious disease in other countries, kita walaupun duduk negara lain, we have to to be aware and as much as possible kena tolong mereka supaya the disease does not land in our country. If you biar them, the poor countries, untuk handle on their own, the things will get worse. Okay, that is what happening in China lah. Tapi China is not, they are not poor lah. They are rich, that's why it landed in other countries. Because orang-orang kaya boleh naik kapal terbang. Okay, so Ebola is not an issue, thank God. Okay, sebab dia negara dia miskin. Okay. Okay, the concept is that bila ada negara yang merana because of disease, we have a duty to go help them. Okay, before we also terlibat. Okay, so pandemic. Okay, Malaysia at one time was the number one. Okay, now we are one of the worst, I would say. Okay, because of our political issues lah. Alright. So let's say Malaysia dah bebas with COVID, okay? That is the aim. Tapi kalau ada negara lain yang belum selesai, it can boleh jadi balik the outbreak, okay? The pandemic is very difficult to tackle, okay? Kalau our own country selamat, okay? But the other countries is still in trouble, it can still come back to us, okay? So we have to work together. And it has become a global health issues that needs global solution. You tak boleh selfish. Okay, but the reality is Malaysia, our vaccine is landing soon, I think end of February. Tapi the reality is banyak negara lain yang tak mampu nak beli vaksin. Okay, what about them? That is something that we have to think about. Okay. Alright. Okay, so these are the global health issues that I've mentioned. So this is the global health ethics, alright, that you have already learned tanpa disedari. Okay, global health ethics is means through to promote widely values, moral values yang boleh pakai dekat mana-mana sahaja. Alright, you already learned this, and this is the we call as principle of biomedical ethics. Okay, this principle teaches us, okay, you kena hormat autonomi, hormat you tak perlu ikut, hormat je. Kadang-kadang autonomi itu mengada-ngada, alright? So as you can see in the previous slides, you kena hormat, tapi kalau tak boleh hormat tak apa, okay? You kena consider the benefits and the side effects. You kena be fair, okay? And this principle is famous sebab you pergi mana-mana negara, it can be applied. It boleh sesuai dengan mana-mana culture, sesuai dengan mana-mana agama. Okay, so what is global health ethics? They ajar this medical ethics, these four principle, okay? Supaya kita punya healthcare is ethical, our healthcare policy is also ethical. Okay, as you can see, walaupun the teaching is being taught all over the world, tapi banyak je yang ada breach human rights. Okay, alright, so that is widely values. Okay, also meaningful to respect human lives. Okay, this one already you guys tanpa disedari. I'm not sure whether you dah angkat sumpah the physician oath or not, but I think in year 3 you ada some kind of angkat sumpah lah, ya. Alright, so this is the physician pledge that was updated 4 years ago. Okay, you dedicate your life, you dah bersumpah nak dedicate your life to the service of humanity. Okay, you akan respect human life, ya. You tak akan permit consideration of age, disease, disability, creed, ethnic origin, gender, nationality. Okay, sexual orientation, social standing. Okay, you dah angkat sumpah. Okay, this is a concept of global health ethics. Ya, you tak akan discriminate siapa-siapa. Tak akan discriminate siapa-siapa based on nationality, gender, and etc. Okay. Alright, so global health ethics also they want to promote human rights. Yeah. Okay. Human rights is based on the Universal Declaration of Human Rights. Yeah. At the end of the World War II, where the UN was established. Okay, so they declare this is the aim of the peaceful world lah. Okay, tak ada torture, tak ada slavery. Okay, no death penalty in Malaysia we still have. Yeah, fair trial, no torture, free election. Yeah, freedom of expression, protection of property, and this has significant impact to the well-being of the individual and the public. Okay, ni pun walaupun tak directly kena mengena masa praktis dari doktor, but it's related to healthcare and well-being. Okay. Alright, Malaysia is very famous for human right breach. Okay, last year if you remember ada seorang mamak Bangla yang kena hantar balik tu. Okay, Human Rights Watch dah mengutuk Malaysia because of our action. Okay, but the most famous now at the moment is the kilang sarung tangan ni. Okay, kilang sarung tangan top glove tu. Alright, if you are aware of this, there are serious human rights breaches in our land. Yeah. Kita macam memperhambakan orang warga asing untuk buat kerja-kerja yang teruk lah. Okay, they are not fairly compensated. Okay, walaupun dia kilang sarung tangan je, the implication is that as a country we are now being perceived very badly in the global stage. Yeah, banyak investors are running away from us because they do not want to be seen as supporting a country that breach human rights. Okay. Now the company has been banned from many countries and this has serious impact to our economy. Okay, sebab kilang glove tu orang lain pun takut nak invest, nak buka, nak beli barang perubatan dekat Malaysia, and this has to be considered as well. Okay, bila we do not follow the human rights, okay, it has implication. People will boycott us. Okay, so Canada dah ban. There's a video on that. Dia memang dah ban Malaysian punya products. America also dah ban Malaysian punya products, especially ketah made from gloves, but there are other products as well that they still buy lah. Okay, so human rights issue is a serious matter. We tend to exploit the foreigners, okay, to the benefit of orang buat business. Okay, that's why we have so many foreigners in Malaysia, and this is why the business community they like to employ foreigners because they can be easily exploited. Okay, so you boleh cram dia ramai-ramai duduk dalam satu container, for example. Okay, alright. So that is the issues. Alright, global health ethics also consider equity. Alright. So what is equity? Yeah. Equality and equity is not equal. Ya, equality bagi semua orang sama. Equity is you bantu siapa yang lebih memerlukan. Okay, that's why it focuses on people who are being discriminated. Okay, it focuses on the poor people. Okay, that is equity. Alright. So equity is not just about giving money. It's also about giving fair opportunity lah. You bagi education. You bagi dia peluang untuk dapat rumah, ya. You allow them to be accepted in the community and have them healthy food lah. Alright. For example, for our Rohingya, ya, dekat Malaysia ni education tak ada, rumah pun masih duduk rumah kongsi, dia tak boleh buka bank, dia tak boleh pergi business, dia tak boleh berniaga, and that is not good for them. Okay, they would all be living unhealthily, and that eventually will affect us Malaysian as well. Alright, so global health ethics also focus on issue environmental. Okay, so dulu-dulu we have a different goal. Ya, semuanya tak nak miskin, zero hunger, sama-sama dalam education, gender equality. But now we also tambah benda baru, climate, yeah, because this is affecting our life. So yeah, This is something fancy lah. Alright. Alright, and the core component of global health ethics is kita jaga kita, something like that. Okay, so jangan kita jaga Malaysia je, kita kena jaga Indonesia, kita kena jaga Bangla, kena jaga juga. Alright, so why is global health ethics important? Okay, sebab you can see these comments everywhere in social media. For example, Rohingya pergi balik negara kau. Alright, dah ramai-ramai kat sini, pergilah balik, pergi lawan. Okay, jangan datang sini. Alright, so this is very common, and there has been threats to global health. For example, banyak countries yang against World Health Organization. For example, America, dia banyak sekali bagi duit dekat WHO, but now they are withdrawing, so WHO is in a very hot spot, right? But fortunately, there is a new president in the United States lah. Alright. So these are the common arguments against global health that you are probably aware. Okay. Alright. The number one objection to global health is that kenapa kita perlu jaga orang yang lebih jauh daripada kita. Okay. So the counter argument is that kalau kita tak tolong diorang, the problem will eventually reach our doorstep. Okay. Fortunately, Ebola is not as contagious as the pandemic, COVID-19, so that's why it does not reach us. Tapi we have to be aware, if there is some incidents that happens, outbreak mana-mana berbahaya, we have to care, we have to help them. Okay, so that is the counter argument. The other problem that people tend to ignore about global health, dia cakap kenapa nak sibuk-sibuk jaga orang lain, rakyat sendiri pun tak jaga lagi. Okay, so that is the some challenges against global health, right? Okay, negara lain pergi tolong, negara rakyat sendiri tak pergi tolong. Alright, this is the survey that I just shared with you. Alright, so this is asked by a doctor in Facebook group. Okay, so this is some of the reply yang some of the doctors that they have replied lah. Alright, so if you can see, kalau patient tu datang government hospital, there is a policy in the government hospital, jika dia pendatang asing tanpa izin, we as a doctor, we have to report. Okay, but that policy has been revoked. Okay, sebab they found out that this patient, dia tak akan datang hospital, eventually they will die. Okay, and the problem is, kalau dia mati sebab sakit jantung, okay, but if they die because of if they have infectious disease, if we do not treat them early, that infectious disease will be transmitted to Malaysian pula. Okay, so you tak boleh buat polisi macam tu, and that policy has been reversed. Okay, sekarang kita tak report. In fact, kalau ada infectious disease, kita bagi free treatment. Okay, so but unfortunately, for macam doktor ni mention, that's why banyak parti tak nak pergi hospital. Kalau dah appendicitis, I tak boleh handle, ask them to go, but they refuse. And this doctor cakap, I ada patient yang acute appendicitis, refuse referral, inform to his boss say will take responsibility, but tak pergi pun hospital. Okay, next morning mati dekat rumah. Alright, so this is very normal things that is happening in our country. Foreigners yang tak ada dokumen. Okay, so some people take advantage on them. Dia tahu they do not have the permit and everything, they tahu lagi banyak lah, they charge lebih banyak. Okay, this doctor they charge 200 per head. Okay, nak buat untung. Right, so this is your response. Okay, don't worry, this is not attendance ke apa ke. The question is, with the recent COVID-19 pandemic, should we report all illegal immigrants that presented to our clinic? So this is a real question. Alright, so majority, I would say I would immediately report to the police, as illegal immigrants are criminals under Malaysian law. Okay, the minority would say I would not report, they need our help. Okay, ada yang tengah-tengah, I would only report if the patient had COVID symptoms. Okay, But the problem with COVID yang the doctors are arguing in Facebook, macam mana you tahu dia symptomatic, ya? Takkan you nak report masa dia symptomatic je, sebab now there are so many patients who are asymptomatic. Okay, there is this is a form of discrimination lah. You assume that they are just they are illegal, meaning that they have an infectious disease. Okay. Alright, there is no right and wrong answer. Okay, but the aim of this lecture is to highlight that we as a Malaysian has been programmed, yeah, as a human being we has been programmed to discriminate people. Okay, if you are not a medical student, if you are not going to be a medical doctor, that is okay. Okay, tapi the problem is our position, we are going to be a doctor, we are a champion of human rights. Okay, we are the protector of humanity. We have to treat them, okay, walaupun dia criminal yang bunuh orang. Alright, so if they are just an illegal immigrant, you tak perlu sebenarnya nak report. Okay, alright, but this is not something yang nak tegur ke apa, but this is the reality. Okay, if you buat survey, the same survey dekat medical doctors, this is the problem in Malaysia. Okay, kalau dia remain as a doctor dekat klinik biasa is okay. The problem is bila dia jadi boss, dia buat policy, they will discriminate people in a large scale, which is it will become a problem. Yeah, like I mentioned before, ada policy doktor kena report. Okay, another policy, patient tu kena bayar deposit. Kalau tak bayar deposit, kita hantar dia keluar. So doctors conflicted. Okay, some doctors dia kesian, dia tolong bayar dulu. Right, this is what happening in Malaysia, but fortunately dah settle because ada orang cakap it is unethical. Right, so we will ulas this case. Okay, so for ethics, if you are presented this issue, for example, as much as possible jangan consider one side of argument, you kena consider both sides. Okay, the first side is we should not report. Okay, the argument is we have taken oath to treat patient regardless of nationality, right? And on top of that, tak ada undang-undang yang minta doktor untuk report illegal immigrant. Okay, alright, ada undang-undang yang minta you report child abuse. Okay, tak ada undang-undang yang suruh you report illegal immigrant. Okay, dekat KKM ada policy, but that policy was overturned. Okay, the other argument is they are refugees seeking protection. They are human tools. Yeah, they have human rights to healthcare. Kalau you pergi report, then they have no longer the safe place to seek healthcare. And this is against the solidarity, which is a global health ethics concept. And if you look at the utilitarian argument, kalau you tangkap dia, they will not get treatment and you will be in trouble also. Okay, but the counter arguments is they are illegal. Okay, they need to be isolated from the public, okay, to prevent spread of COVID-19. But nowadays this argument is no longer valid. Masa tahun lepas, yes, banyak foreigners yang positif COVID, but now you see the Malaysian lagi ramai. Okay, but we are not isolating Malaysians. Okay, the most important thing is that in diplomacy, in policy making, memang akan ada orang setuju, memang ada orang yang tak akan setuju, but the most important thing is to find the middle ground. Okay, so perhaps if no symptoms, it's probably best not to report. Kalau patient tu datang for fungal infection, takkan pun kena pergi report polis kan. Okay, kalau they have symptoms of COVID and you suspect there is a serious outbreak in their community, that is justifiable if you report. Okay, and if you confirm then this patient memang ada COVID symptoms, that is mandatory to report. Okay, kalau dia tak ada symptoms, memang you tak perlu report. Kalau you suspected, you perlu report. This is based on the Infectious Disease Act. Okay, for now there is no law that requires doctor to report crime. Okay, with the exception for Child Act. Okay, alright, we are first and foremost a doctor. We are treating human beings. Okay, we should not be the police. Okay, we want people to approach us. Kalau jumpa polis, orang lari. Okay, so kalau if the government want us to report this, they should amend the law lah, buat undang-undang doktor kena report parti, and that is okay. For now, there is no such law. Okay, it is unfair for us to be placed in such ethical dilemma. Alright, we should not be placed. Okay, and if the government decides that we have to report, alright, for public health reason, yeah, the condition of the detention center must be improved. Ya, tak boleh letak ramai-ramai macam tin sardin. You kena ada, must be able to separate them individually supaya tak ada outbreak. Okay. The refugee centers must be improved. Perlu ada education, sanitation properly. Okay. Yang ada lesen untuk bekerja, legal immigrants, workers need better housing facilities as well. Okay, kita tak boleh exploit them so much. Okay. This is even our health DG pun dah mention the same thing, ya. The immigration centers has to be improved, ya. If you tak buat, you tak follow the human rights to healthcare, that is why we have banyak outbreak dalam detention center. Okay, so foreign worker yang bekerja secara legal pun kena take care of their welfare, ya. So tak boleh pack macam nanti saja macam ni. Okay, for some of you think this is not so bad. Okay, because ada 6 katil, right? In general ada 6 katil, and this 6 katil is not for 6 individual, it's for 12 individual. The katil is by shift. Alright, so dia pergi kerja malam, orang pagi, dia kerja malam, orang pagi boleh tidur. So they take turns to sleep. Okay, so when MCO last time, the first MCO happened, semua factory kena tutup, then baru akan jadi overcrowding. Okay, and that is a serious problem. Alright. Alright, so this is the partners in global health. The easiest one everybody recognize is World Health Organization. Yeah, so they memang buat policy for the countries that is in United Nations. Okay, UNICEF is for children. Yeah, UNHCR is for refugees. Malaysia is not part of UNHCR, tapi we allow this body to come and collect donation. Dia pun ada aktiviti sendirilah. Okay, alright, so there are various the local NGOs that support global health. Alright, that is the lecture. Any questions so far for global health? Ada bantahan ke? Any question?
No. Assalamualaikum, Doctor. I have a question.
Yes, please.
Doctor, for example, this is a bit out of topic, but what if we collect a urine sample from a patient and it turns out to be like ada dadah? That we have to report ke tak yah? Tak yah kan? Thank you, Doctor.
Very good questions. Okay, urine test for dadah has 2 conditions. Number 1 is voluntary testing untuk pergi minta kerja. Okay, yang tu kalau positif, you tak payah report. Okay, you bagi tahu kat patient you punya positif, you nak saya tulis ke? Patient would definitely say no. Okay, dan dia suruh you tipu, you pun boleh cakap no, tak boleh, saya kena tulis yang betul. You kena cari doktor lain yang boleh tipu untuk you. Okay, that one you boleh omit, you tak payah report. There is also another one, urine testing. Yang ni testing yang wajib lah, patient tu dah kena tangkap. Okay, polis bawa dia pergi kecemasan untuk suruh ambil darah for investigation, for example alcohol level, ataupun dadah untuk urine test lah. Itu wajib report. Okay, boleh. Tapi nowadays we do not do the testing for crimes. Kita ambil darah je, tapi yang buat test tu selalunya Jabatan Kimia. Dulu-dulu yes kita buat. Boleh faham?
Faham, Doktor. Thank you.
Okay, if tak ada any other questions, next week kita akan ada tutorial. I will pass the question in a few days. But next week, some of the groups maybe kena merge kot sebab tak cukup lecturer to do the tutorial. Okay. Your exam for year 4 is definitely postponed. Bila tu tak pasti. Okay. Most likely end of March or end of early of April. I will confirm the dates with you later. Okay. But at the same time, maybe the portfolio presentation has to be slightly adjusted, but the submission time will remain the same lah for the essay. Okay, if you guys have any other questions, can always WhatsApp me or email me ke apa ke. Alright. Let me take the attendance. Okay. Sekejap ni. Okay. Alright, thank you everyone. Stay safe.
Thank you, Doctor.
Thank you so much,
Doctor.
Doctor.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.